Good morning. My name is Courtney Littleton, and I am the project coordinator for the Mental Health Awareness Training Grant with the Mississippi Department of Mental Health. Today, we're going to be talking about helping our youth during COVID-19. The Mississippi Department of Mental Health provides hope by supporting a continuum of care for people with mental illness, intellectual or developmental disabilities, and alcohol and drug addiction. Services are provided through our state-operated programs and community service programs, regional community mental health centers, and other nonprofit profit service agencies and organizations. During the COVID-19 pandemic, we've had to adjust to living with social distancing, quarantine, and other uncertainties. Our stress levels and worries may have doubled due to the loss of jobs, educational opportunities, and the worry about our health, along with added responsibilities such as educating our students. For our students, school stopped, sports stopped, and the social activities stopped. Is a youth in your life feeling sad, anxious, or angry? Are they agitated, restless, inattentive, or have poor focus? Complain of symptoms like headaches or stomach aches, avoiding, having tantrums, crying, or refusing to participate in school activities? Do they seem to have meltdowns about clothing, hair, shoes, or even socks before preparing to leave home? Meltdowns about schoolwork, difficulties with transitioning between schoolwork and other activities, difficulty settling down for bed, and high expectations for their schoolwork, homework, and sports performances. COVID-19 is a health and economic crisis. It has affected everyone in a big way. According to the National Association of School Psychologists, families across the country are adapting to the evolving changes in daily life caused by the COVID-19 pandemic. Most schools, places of public gatherings, and non-essential businesses have experienced closures, or they're operating with new procedures and requirements as a result of the pandemic. And for our parents and caregivers, they're facing a need to help their families adjust to the new normal. This includes trying to keep children occupied, feeling safe, and attempting to keep up with schoolwork as best as possible. Can you think of any other examples in your life where your life has changed due to the COVID-19 pandemic? None of this is easy, but it helps to stay focused on what is possible in order to reinforce a sense of control and to reassure children that they are okay and that the situation will get better. Mental health. It is more important now than ever before to protect our mental health and well-being and support those around us. Feeling anxiety or depression is a common reaction. Unfortunately, mental health disorders like anxiety don't have a minimum age requirement. These disorders can be difficult and traumatizing both for the children who experience them and for their parents. The development of anxiety in children can be linked to a situation or a perceived event that is frightening or traumatizing. When our world changes quickly and suddenly, it is common to experience changes in our thoughts, feelings, and behaviors. It's common to experience anxiety and depression. Although the terms are often used interchangeably, poor mental health and mental illness are not the same things. A person can experience poor mental health and not be diagnosed with a mental illness. Likewise, a person diagnosed with a mental illness can experience periods of physical, mental, and social well-being. Your mental health is how you feel about yourself emotionally, psychologically, and socially. Everyone has mental health, and it is ever changing. Mental illnesses are diagnosable conditions that affect a person's thinking, feeling, mood, or behavior. Mental disorders among children are described as serious changes in the way children typically learn, behave, or handle their emotions. which cause distress and problems getting through the day. Common mental illnesses include depression, anxiety, bipolar disorder, or schizophrenia. These conditions could affect a person's ability to relate to others and function each day. Each person's story is different, and it is so important to understand that recovery from mental illnesses is possible. People who have been diagnosed with a mental illness go on to lead meaningful lives through their work, education, social roles, and in their families, especially when they have sought treatment. Mental health problems are not always just the result of one event. A person's genetics, life experiences, or lifestyle can influence whether they develop a mental health condition. Biochemical processes and brain structures may play a role in whether a person will develop a mental health problem, as do stressful and traumatic events. According to the National Alliance on Mental Illness, 1 in 5 children have a mental health or learning disorder, and 80% of chronic mental disorders begin in childhood. 50% of mental health disorders begin before age 14 and 75% before age 24. 50 to 80% of youth do not receive the mental health care they need. Health professionals use the guidelines in the American Psychiatric Association's Diagnostic and Statistical Manual, the 5th edition, the DSM-5, to help diagnose mental health disorders in children. There are many risk factors that increases the probability that a young person may develop a mental health disorders. Many mental illnesses share risk factors. Genetics, a history of mental illness in a blood relative, such as a parent or sibling. Stressful events, abuse or trauma. Stressful life situations, such as financial problems, a loved one's death, or a divorce. A childhood history of abuse or neglect. Learned behaviors, chemical imbalances, illnesses that is life-threatening, chronic, or associated with pain. An ongoing chronic medical condition. Brain injury, brain damage as a result of a serious injury, such as a violent blow to the head, substance misuse, use of alcohol or recreational drugs, seasonal changes, previous episodes of a mental illness or presence of another mental illness, ongoing stress and anxiety, medical conditions and hormonal changes, and side effects of medication are all risk factors for mental illnesses. Trauma is the most powerful risk factor on this list. So what is trauma? What are traumatic events? A traumatic event is an incident experienced by a person that is perceived to be dangerous and threatens serious injury or death. A traumatic event may be on a large-scale disaster like Hurricane Katrina, 9/11, or COVID-19, or may only happen to a single individual. Trauma is not always a single incident. Rather, it may be recurring abuse or bullying. One person may perceive an event as deeply traumatic, but another may not. Certain types of trauma affect some people, some individuals more than others. A history of trauma may make some people more vulnerable to later traumatic events, whereas others become more resilient. Youth may respond differently than adults, depending on their age and psychological maturity. Common examples of traumas that affect individuals include accidents, assault, including physical or sexual assault, mugging, robberies, or family violence, and witnessing something terrible happen. Mass traumatic events include terrorist acts, mass shootings, warfare, and military activity, and severe weather events such as hurricanes, tornadoes, and floods, along with fires. Coping with the death of an important person in one's life is especially difficult for youth. Painful medical procedures or the sudden loss of a parent or caregiver can cause young children to experience traumatic stress, and experiencing a pandemic can also be a traumatic event. Typical reactions may include feeling stressed or overwhelmed, frustrated or angry, worried or anxious. Our youth may feel restless, agitated, on high alert, or unable to calm down. They may be teary-eyed, sad, fatigued, or tired, losing interest in usually enjoyable activities, or finding it difficult to feel happy. A child who has experienced a traumatic event may react strongly right away, and then others may have a delayed reaction. Events that remind us of the trauma may bring back fears, intense physical reactions, and post-traumatic stress reactions long after the trauma has occurred. Worrying about going to public spaces, becoming unwell, or contacting germs are reactions that could possibly be due to COVID-19. Constantly thinking about the situation, unable to move on or think about much else, experiencing physical symptoms such as increased fatigue or uncomfortable sensations can all be reactions to a traumatic event. As adults, whether in the role of a parent, caregiver, or teacher, it is very important to remember that children look to adults for guidance on how to react to stressful events. During and after COVID-19, it is important that adults acknowledge some level of concern without panicking. It is appropriate and important to take the necessary actions that reduce the risk of illness. Teaching the children positive preventive measures, talking with them about their fears, and giving them a sense of some control over their risk of infection can help reduce anxiety. Remind the youth or the teen in your life that all these thoughts and feelings are common right now. Discuss simple self-care strategies that will help manage symptoms of anxiety and depression. Self-care and coping strategies are things you can do to manage your symptoms, relax, and stay calm. Encourage the youth in your life to utilize things that they are interested in to help them stay calm and deal with stress. Things like reading a book, journaling or writing, using kind and powerful self-talk, such as things like saying things to themselves like, I can do this, things will get better, make a collage or scrapbook, rest, nap, or take a break, go on a walk or run, do something kind or that makes you feel good, listening to music, singing, and or dancing. Riding a bike, asking for help, talking to someone you trust, building something, using positive affirmations, taking slow mindful breaths, crying, using a stress ball or other fidget items, getting plenty of sleep, eating healthy, and playing outside. These strategies help reduce stress. However, some strategies may increase stress, so it is really important to find what works for you, something that you are possibly interested in or that truly decreases your level of stress. As we've discussed, the COVID-19 pandemic has likely brought many changes to how you and your youth in your life live your life, and with it uncertainties, altered daily routines, financial pressures, and social isolation. The youth may worry about getting sick, how long the pandemic will last, and what the future will bring. Information overload, rumors, and misinformation can make a youth's life feel out of control and make it unclear what to do. During the COVID-19 pandemic, our youth may experience stress, anxiety, fear, sadness, and loneliness. And mental health disorders, including anxiety and depression, can worsen. Everyone reacts differently to difficult situations, and it's normal to feel stressed and worried during a crisis. But multiple challenges daily and changes such as the effects of COVID-19 pandemic, can push a youth beyond their ability to cope. COVID-19 and suicide. Social distancing, quarantine, and increased stress and worry may cause youth and teens to experience suicidal thoughts. According to recent studies, suicide is the second leading cause of death among persons aged 10 to 24 in the United States, accounting for 5,178 deaths. High school students report higher rates of suicide behaviors. Current suicide attempt rates are estimated to be as high as 21.8% in girls and 11.8% in boys. The Department of Mental Health has a suicide prevention app that can provide a quick reference to understand the warning signs of suicide, how to help a person who is suicidal, and links to available resources. You can download the app by searching Shatter the Silence in your app store. We would like you to really pay close attention to the warning signs of suicide. Warning signs that a youth may be suicidal. They may say things and they may threaten to hurt or kill themselves, seek access to pills, weapons, or other means to kill themselves, talking, writing, or drawing about death, dying, or suicide, expressing hopelessness, no reason for living, or having no sense of purpose in life. They may say things like, I don't want to do this anymore. I can't take this. You'd be better off without me. Having rage, anger, or seeking revenge, acting recklessly or engaging in risky activities, seemingly without thinking, feeling trapped, making statements of feeling trapped. Some more warning signs that a young person may be suicidal. They may withdraw from family, friends, or society, have a dramatic change in mood. Having a dramatic change in mood is one of the warning signs that adults sometimes miss. When a young person has made a decision to die by suicide, you may see their mood get better. They are happier and calmer. And as adults, we think they are getting back to normal. Things are getting better for them. However, their mood is better because they have made a decision and it feels like a weight has been lifted. So we want to pay really close attention to a young person who is experiencing a traumatic change in mood. Increased alcohol or drug use or risky behaviors, sleeping all the time or being unable to sleep, being anxious or agitated, and giving away prized possessions. How can you help? Take a few moments to talk with the youth and teens in your life about how they are feeling and what may help them during this difficult time. Identify if they're experiencing a crisis such as suicidal thoughts and address that first. If you've noticed or observed some of the warning signs we discussed in the previous slides, we want to address that first. We need to be direct and ask them if they are thinking about suicide. As adults, sometimes it is uncomfortable for us to ask our family members, the youth in our lives, about suicide and about killing themselves because of past myths and because of things that we've heard before. But it is really important to be direct and to ask the question, are you thinking about suicide? Are you thinking about killing yourself? It's okay to do the assessment over the phone, text, or social media. If the person's life is in immediate danger, call 911. If the person or young person isn't in a crisis, ask how they're feeling and how long they've been feeling this way. Actively listen to them. Pay attention and show you care. Don't judge and push your beliefs off on them. As adults, we can be accepting and understanding and not agree with the things that they believe and say. Let them know that you are not alone and there is someone that can help them. Your support can have a huge impact on the person. Reassure them that it is appropriate to experience fear, sadness, or anxiety during situations like this. Remind them that help is available and you will be there for them along the way. Let them know that they are not alone and recovery is possible. Help link them to someone that can help. Offer to help them find a professional for support, such as a primary care physician, mental health professional, psychiatrist, or certified peer specialist. Behavioral health care providers can provide services by phone and or secure video conferencing, so they will be able to maintain physical distancing. Also, you can offer to go with them to speak to a professional if that is needed. Tips for coping. These are some tips to help our youth and teens in our lives to cope with things. Maintain a daily routine. Stay connected with others and try to find moments of humor. Talk to people you feel comfortable with about your feelings or worries. Then give yourself permission to stop worrying. Eat breakfast every morning, plus snacks and meals at regular times throughout the day. Limit coffee or energy drinks, as these will increase feelings of anxiety and make it difficult to relax. Look for patterns or be aware of situations that make you feel particularly worried or anxious. When you're in these situations, try relaxation or distraction techniques, or ask a family member or friend to help. Relieve times of high anxiety with physical activity. Engage in regular aerobic exercise like walking, jogging, dancing, yoga. Limit the amount of time you spend watching or talking about or listening to news media or social media if you are feeling information about the COVID-19 situation overwhelming or distressing. Do hobbies or activities that you enjoy, calm you down, or focus your mind and body. These could be arts and crafts, physical activity, listening to music, reading, journaling, watching TV or movies, or talking with friends. Understand that the people around you are probably also finding this situation stressful, and they may also be having difficulty controlling their emotions. Try to resolve conflict positively. If you continue to feel overwhelmed, out of control, or unable to calm down after a period of weeks, seek help from a mental health professional. So if the youth in your life continues to experience overwhelming frustrations, stressful feelings, and anxiety, please seek help. Take time for yourself. Be kind to yourself and each other. These are a list of resources that you can utilize to find help or to find services in your local area. Mississippi recently launched a Mental Health Mississippi, a website created to help you easily access mental health services for children and adults in Mississippi. You can search mentalhealthmississippi.com for services and resources in your local area. Visit the site to also find COVID-19 resources and also resources such as our mobile crisis response teams, crisis lifelines, and DMH helpline, all of which are available 24 hours a day, 7 days a week to help. Remember that you are not alone. If the Mississippi Department of Mental Health can help support you, please don't hesitate to contact me, Courtney Littleton, at courtney.littleton@dmh.ms.gov. Continue to practice social distancing and be safe. Want to know more about mental health and your children? Contact me about Youth Mental Health First Aid Training. Youth Mental Health First Aid is the initial help offered to a young person developing a mental health or substance use problem or experiencing a mental health crisis. The first aid is given until appropriate treatment and support are received or until the crisis resolves. The training is offered at no cost to you through a mental health awareness training grant from the Substance Abuse and Mental Health Services Administration. This training has been approved to offer continued education units for educators and school resource officers. For more information or to request a training, please contact me, courtney.littleton@dmh.ms.gov. Thank you for taking the time to view this training. Our hope is that this information is helpful to you, and if you're in need of any services or any help, that you will utilize the information in this training to seek help. There is help available, and remember that you are not alone. Both the DMH helpline and disaster distress helplines are available 24 hours a day, 7 days a week. Don't forget to practice self-care and stay healthy.